Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, I'm going to be covering part 2 of test taking strategy, test tips, important things to know. It's not in any particular order, but I would suggest if you're watching this video first, which is a part 2, make sure you go back and watch part 1. So before I get started, guys, I'm going to always ask you to please support me, support my channel, help me to grow by liking this video, subscribing to my channel, engaging with me in the comment section. Let me know what you think of the video. Let me know what you'd like to see covered. If you can share my video on your social media platform or with a classmate, with a nursing instructor, I would be very, very grateful. Don't forget, I have audio lessons available for you on my website, nexusnursinginstitute.com. And you guys can catch me almost daily covering different types of nursing questions on my other social media platforms, such as TikTok, Instagram, and Facebook. So part 1, I covered 1 through 15. This video is going to be a short video as well. I'm going to cover 16 through 30. So let's jump in. Look at number 16. Wherever there is sugar, which is glucose, water follows. And guys, this is very true. It's a very true concept to know. And the reason for that is that glucose is polar molecule. Okay. And so the negative and the positive poles attract water molecules. So where there's glucose, yes, fluid water follows. Number 17, aspirin can cause Reye syndrome encephalopathy when given to children. We never give aspirin to children. If a child has a fever, they may get Tylenol. They may get acetaminophen, excuse me, genetic. I'm saying genetic. What's the G where I'm looking? Generic. They may get acetaminophen. They may get Motrin, right? They may get ibuprofen. We're not giving them aspirin because the thing is, especially if that patient has a viral infection, they can get Reye syndrome. So we do not give aspirin to children. I can count on my fingers how many conditions that we ever give aspirin to a child. Like one would be something like Kawasaki's, but we never give aspirin. Just a rule of thumb, unless there's like 3 or 4 that we're going to give aspirin to a child, we never give aspirin to children. We don't take that chance. Number 18, when aspirin's given once a day, it acts as an antiplatelet. Notice that it says antiplatelet, so it prevents those platelets from clumping up, forming a clot. It does not break platelets, right? So that's why a patient who has a history of MI or other heart conditions, the healthcare provider may order baby aspirin, the 81 milligram once a day to keep them, or maybe that patient has a history of AFib, to keep them from forming platelets, but it does not break down platelets. That's number 1. And number 2, something important to know, if you get a test question about a patient who's been taking aspirin long term, you know that this patient's at risk for what? Bleeding. So you know part of your assessment is going to be asking questions and physically assessing that patient about, the gum when they brush their teeth. Is it pink tinge? When they have their stool, is there any blood in the stool or even in the urine? Are they bruising easily? That's something important for you guys to keep in mind. Number 19. Use cold for acute pain, such as sprained an ankle, and heat for chronic pain, such as rheumatoid arthritis. So let's talk about this, guys. Something acute, such as a sprain. When it comes to sprain, it comes to fractures, we use RICE, rest, ice, compression, elevation. And that cold, that ice, it causes what? Vasoconstriction. It stops all of that fluid from causing what? Swelling, edema. And look what it says here, heat for chronic conditions such as rheumatoid arthritis. That heat causes vasodilation and it's soothing. Number 20, guided imagery is great for chronic pain. Notice that it said chronic pain and not acute pain. If a patient has something acutely going on with them and they are in pain, first of all, we need to assess to find out what's causing that acute pain, right? And then we're going to intervene as appropriate. Guided imagery is great for chronic pain, something that this patient's been dealing with for an extended amount of time. It's controlled, but they still have it. And so that is a great thing for the patient with chronic pain. Number 21, when a patient's in distress, something's actively going on with them, medication administration is rarely a good choice. Let me tell you something. If something is actively going on with your patient, you choose that answer of just giving them a medication, you're ignoring what's wrong with the patient. If something's actively going on with them, what do you have to do? You have to assess. You have to assess your patient. Remember ADPI, assessment, diagnosis, planning, intervention, evaluation, you assess first. And the only time you jump from assessment to your intervention is if in the body of the question, they gave you enough information that you know you assess that patient, you know what's going on with them. So that's how you know what your nursing intervention is going to be. With pneumonia, fever and chills are usually present. For the elderly, confusion is often present. Let's talk about that. And this is not only pneumonia. I don't know why they put pneumonia. This is with infection period, because it's also with UTIs, but let's talk about it. So with pneumonia, patient's going to get these generalized systemic symptoms such as a fever, such as the chills, absolutely. But with your geriatric patients, a couple things you need to remember with the geriatric population. They're usually not as hydrated as they should be, right? Because the older that they get, they kind of lose their sense of thirst. That's why it's so important to constantly remind them to take sips of water. That's why you put straws in their cups, so it's easier for them to keep drinking. Their kidneys not working the way it used to be. Their liver's not working the way it used to work. So it's easy for them to have drug toxicity, right? It's easy for drugs to accumulate in their body. So those normal signs and symptoms of infection or inflammation that you would see in a younger, healthier person, not so much in an elderly person. As a matter of fact, one of the first signs and symptoms of infection doesn't have to necessarily be pneumonia. I'm talking about infection across the board. When it comes to an elderly person, is confusion. If you had a patient that was always awake, alert, oriented ×3, they were together. Now all of a sudden they see grandma flying across the room. You better think infection. 23, always check for allergies before administering antibiotics, especially penicillin. Make sure culture and sensitivity has been done before administering the first dose of antibiotic. So something that I didn't see here, but you definitely need to know it for testing purposes. If a patient is allergic to cephalosporin, to penicillin, you're not going to give them a cephalosporin. If they're allergic to cephalosporin, you are not going to give them a penicillin, because there's certain properties that are in both of those medications, and you don't want to take that chance of that property of the medication. That's what the patient is allergic to. So that is very important. Before you give any antibiotic, you need to make sure the patient's not allergic. If it's a cephalosporin or penicillin that they're allergic to, you're not going to give the other. There was something else I wanted to tell you about this one. Yes, make sure culture and sensitivity is done before administering the first antibiotic. Why? You don't want that antibiotic to skew the results of the culture and sensitivity. Okay? Pulmonary, this is right-sided heart failure that's caused by pulmonary disease. It occurs in bronchitis and emphysema. And here, in parentheses, you see signs and symptoms of overload. The distended jugular veins, the ascites, the hepatomegaly, the splenomegaly, the edema, all those signs and symptoms of fluid overload. Okay. The second thing I want to bring to your attention is bronchitis and emphysema. These are part of COPD. Asthma is not. Asthma is at least partially reversible. COPD and bronchitis is not. That's very important for you guys to know. Something else I'm going to bring to your attention, since we're talking about bronchitis and emphysema anyway. When it comes to bronchitis, I want you to think of blue bloaters. So these patients are tend to have that bluish tinge because what? They're lacking what? Oxygen. It's called blue bloater. The reason blue bloater, the bloater part is because of that barrel chest. They're holding on to all of this CO2. So they're blue because of the lack of oxygen, and bloater because of the barrel chest are holding on to that CO2. Now, emphysema, patients with emphysema, those are known as the pink puffers. Pink because the body's trying to compensate. They don't have enough CO2. Because of that lack of CO2, the bone marrow starts producing and shooting out all of these RBCs, because remember, inside of the RBCs is hemoglobin. What does hemoglobin carry? Oxygen. So because of all these RBCs that the bone marrow makes to try to compensate for the lack of oxygen, they're pink. Why is it pink puffer? Puffer, again, because of the barrel chest, they're holding on to all that CO2. So that's a big difference between bronchitis and emphysema that you absolutely need to know. With bronchitis, they tend to be blue, and with emphysema, they tend to be pink. Okay, blue bloater, pink puffer. Number 25, COPD is chronic. It is ongoing. It is insidious. COPD is chronic. Pneumonia is acute. Pneumonia happens like this. It's not something that just sneaks up on you. It's not something that's long-term, okay? COPD is chronic. Pneumonia is acute. Emphysema and bronchitis are both what? COPD. 26. In COPD, patients have baroreceptors that detect CO2 levels are destroyed. Therefore, oxygen levels must be low because of the high concentration. Now, with this being said, guys, I know recent studies have come out and shown that it's not absolutely necessary that we have the COPD patients on very low oxygen, such as 2 liters. But guys, until NCLEX changes, you better go by what they want for you if you want to pass. So for testing purposes, if they go out of their way to let you know that this patient has chronically been exposed to high CO2 levels, low oxygen levels, is that a good patient to put on 4 liters, 5 liters of oxygen? No. So this is important for you to know. All right, number 27. Put this over for you. 27, exacerbation, acute, distress. So for example, patient may have COPD, and COPD is chronic. It's long-term, it's insidious, right? But what if they have COPD exacerbation? That chronic condition just turned into something that was acute. Why? Because it's an exacerbation. That patient is in distress and it must be addressed. That's a priority. 28, epi's always given in a TB syringe. Yes, epinephrine. Why? Because you have that 1 milligram per 1 ml. It needs to be given in that 1 cc syringe. True. 29, prednisone toxicity, Cushing syndrome, buffalo hump, moon face, high glucose, hypertension. So let's talk about this. I talk about this in depth on a video I actually just published a few days ago. It's in my pharmacology playlist. What's it called? Adrenal. I think it's called adrenal excess, maybe. But anyway, I talk about this in depth where patients got too much prednisone. This type of steroid, it causes a shift in fat distribution. And so that's why you'll see the patient has a moon face. Their face will be like this, all swollen. You'll see a buffalo hump. They'll have central obesity. They'll have purple striae. They'll have very fragile, thin paper-like skin, right? Their glucose is going to be high because prednisone's very sugary. Their glucose is going to be high. And remember, we said fluid likes to follow glucose. So what do you think is their blood pressure is going to be high? Because within that vascular space, more fluid, more pressure pushing against the vessel wall. So yes, hypertension. What about neurologically? Patient may be confused. Patient may have emotionally, that patient's going to be up and down, or they may just have depression. That's very important to know about prednisone toxicity, those signs and symptoms of Cushing's. And when it comes to Cushing's, I say that all the time, too much salt, sex, and sugar. And lastly, number 30, 4 options for cancer management. If the patient has cancer, they can get chemotherapy, radiation, surgery, or a combination, guys. Or they may choose nothing and choose to die with dignity. Guess what? Either one of those choices, as a nurse, you have to respect the patient's choice. As long as that patient is legally competent to make decisions for themselves, that is their decision to make. All right, guys, this was a short video. This was 15 through 30. Next video, I'll go ahead and do 31 through 45. Again, please let me know what you thought about this video. Don't forget to like, comment, subscribe, and you guys will catch me on my next video.